My name is DiCarlo-Wagner. I'm a yoga teacher and I'm also a 12-year stage 3C colorectal cancer survivor, and I'm an advocate for bringing yoga to cancer patients through social media. I want to talk a little bit about frozen shoulder. This is a condition that can happen at any time, and it can be from an injury or there can be other causes. But it's best that you have a diagnosis by a doctor, and if that's the case and you want to do some gentle yoga moves, this is not yoga physical therapy, this is just some suggested moves that may be helpful. I also want to point out that working in warmth is important because muscles relax when we're a little bit warmer. So have a little fire going. And warming up a muscle can be as simple as heating up a little bit of a rice bag and putting it on the shoulder, just making sure that the muscles get a little bit warm. And there are some over-the-counter things that could be helpful. Arnica, which is a gel. Trusty Bengay. This is an essential oil called Deep Blue by doTERRA that is topical. And if you've never seen salumpas, these are little herbal medicines that come in a patch. You can take the patch off and put it directly onto your shoulder. You do want to make sure that you look at the list of ingredients and make sure you're not allergic to anything. There's some aspirin in this, and so this might be not a good idea for some people. All right, so we've applied something to our shoulder. We're in a warm place, and for the moment, if you're seated either on the ground or in a chair, we're going to allow our arm to simply dangle. And the first movements we're going to do is simply small circles, not to pain. Actually, what we're doing is hoping that we're sending relaxation signals, letting our brain and our shoulder connect, that when we move, it's going to feel good. Because eventually, with an injured area like a frozen shoulder, we get very guarded, muscles get tense, and we don't want to move that area, and our brain thinks every time we move that area it hurts. So some of this is retraining, so we're just doing relaxing movements. Our shoulder has 9 movements, and we're not going to go through all of them, but it has quite a bit of range of motion when it's working appropriately. And if you're working with a physical therapist, you'll be working on that. So here's something else that you can do. Self-massage, making sure that we take a moment to remind this area we should relax, getting in underneath our arms and lymph nodes, and gently just feel good massage. All right, so my hand is resting, so there's no tension in my shoulder, and I'm dropping my shoulders away from my ears, lifting my sternum up, lifting the crown of my head up, and sitting well. So one thing that can happen with injury is we can want to be protective and end up slumping, and that's something that will affect your whole body, not just your shoulder. Your hands are also probably going to be affected, so you want to keep simple range of motion in your hands, opening and closing, and turning up and down. Turning up, turning down. In your shoulder, let's just see what happens by lifting the shoulder up on an inhalation, not to pain, but just that first place you feel tenderness. So slow and easy. Inhale, lift. Exhale, release. Inhale, lift. Exhale, release. And I want you to do this as repetitions, not more than 10, and then change your activity. So now the shoulder can go back and forward. Same thing. You're going to do a few, not to pain. You're going to find that place where you feel sensation and stop and bring it back to center. And you're going to do that not more than 10 repetitions. And now moving shoulder forward and back and forward and back. And by now you know, not more than 10, slow and easy and on your breath. Another way that we can encourage movement without stressing out our shoulder is to let our other hand be helpful. So get a hold of your wrist and let your other arm take the weight and slowly stretching forward and coming back. So this arm is actually doing the work, and my other arm, I'm trying to keep it loose and rested. Okay, out to the side. So fingertips are down, my palms facing toward my hip, and I'm going to walk my hand out. And then I'm going to see if I can lift any amount, and then lower, and lift, and lower. So of course, this joint in full range of motion has 90 degrees. When you get to this 90-degree point, you're going to want to turn your palm up to release the radial nerve in your shoulder. So take any pinch out. And if you've gotten this far, then you're going to start working this half of the range of motion. Okay, and let's dangle in between for that feeling of looseness. Just allowing the arm. A little harder to do in seated, but I just want you to get the idea. This is a good motion anytime. So I want to bend my elbow and see if I can start moving across with my arm. Here again, I can use my other arm to support my elbow and support that range of motion as I'm getting a range of motion across my chest. And this would be extending into full range of motion. So this is what your shoulder can do, but this is maybe where you want to start, way down here, and just rocking back and forth, no pain. I think that that gives you a really good start. And then there are yoga movements with weight, but I think, to me, until you feel a stretching and some fairly good range of motion, then later I would add the strengthening piece of yoga. You might do something different in physical therapy, but let's keep it on the safe side, and always do ask your doctor what's best for you. Blessings. Namaste.